Hey everybody, you're watching a physio named Jonah. That's this guy. Where today we're... Yes? I guess we're doing arthritis. You may have received a diagnosis of it, seen the symptoms on Healthline, or just know that your joints hurt and you're aware that this word can do that. Arthritis is a name that means a lot of different things, as there are many different types of arthritis. But broad strokes, what is arthritis? Why don't we go back to that Healthline definition for a second? This is actually an amazing one-sentence summary of arthritis. It is, quite literally, inflammation in the joint. If we break down arthritis, it has roots from two different words. Arth, the start, comes from arthrology, or the study of joints, and itis refers to inflammation in a given area. So, simply put, arthritis very directly refers to inflammation within a joint. Now, in reference to all of those different types of arthritis, why don't we massively oversimplify them? Because I love to do that. Osteo comes from osteology, or the study of bones, which means that osteoarthritis is inflammation of the joint with bones as the main emphasis of the word. It affects primarily load-bearing joints of the body, such as the hip or knees, but can be found in essentially any other joint throughout the body as well. Osteoarthritis is normally in response to repeated movements or loads placed through the joint, commonly referred to as wear and tear. The subsequent breakdown of cartilage within the joint and narrowing of the joint space helps to create that inflammation and pain pattern that we see. Because it is so linked to wear and tear commonly, we may only see osteoarthritis in one joint at a time, although it can present in more. Rheumatoid arthritis, on the other hand, refers to an immune disorder in which the body damages its own joint capsule and joint lining with self-inflicted inflammation. The end result of joint inflammation is quite similar, however, the cause and the presentation are very different. Rheumatoid arthritis commonly affects small joints of the hands as well as feet and may actually attack the body's own internal organs. Because it is an immune disorder, it is usually seen on both sides of the body and usually throughout multiple joints. Said differently, osteoarthritis is the traditional arthritis that we think of when we imagine wear and tear going through a joint, while rheumatoid arthritis is actually an immune condition which may present itself within the joints, but its cause exists medically elsewhere within the body. I'm going to be spending the rest of the video focusing on osteoarthritis because it's about 10 times more common in presentation than rheumatoid arthritis, and I have much more experience working with osteoarthritis patients. If you'd like to see a video on rheumatoid arthritis, go ahead and let me know in the comments section below, but otherwise, let's get on with the OA. So your joint hurts and it seems to be a bit swollen. It sounds like it could be arthritis, right? Well, besides arthritis, there are a ton of other injuries that could cause joint swelling and or pain. But rather than outline all of those, why don't we go into some of the hallmark symptoms of osteoarthritis. Arthritis is a diagnosis that's made first based on symptoms and then later confirmed with radiology like X-ray. Let's use osteoarthritis of the knee for example here. If I have a patient that tells me they have knee pain, morning stiffness that resolves in 30 minutes or less, and limitations in their activities, osteoarthritis of their knee may be one of my first differential diagnoses that we'll look at. But now we move forward to the objective component of the exam, where if I see crepitus, which is clicking or clunking around a joint, a reduced range of motion that may or may not be associated with pain, and bony enlargement, these findings would make me even more inclined to believe that knee osteoarthritis could be one of the contributing components to this patient's pain. Once a diagnosis of osteoarthritis is made, patients will normally be referred for an X-ray to confirm the diagnosis. Not by me though, because here in Ontario where I practice, outpatient physiotherapists like myself still cannot refer for diagnostic imaging. I have 5 reactions to this. It's totally fine. They're gonna let us make the referrals like any day now. Like, don't even worry about it. Like, just relax. It's gonna happen. It's gonna happen. What do you mean I can't sign the form? Is my signature not good enough? You think you're better than me? Will you x-ray my patient if I give you this box of crackers? No? How about these no-name bagels?
I don't even want the x-rays. I never liked them anyway.
Please make an appointment with your family doctor. Now, after the x-ray is done, the way that osteoarthritis is graded on how severe it is as variable as it is jarringly specific based on which resource you're looking at. But for the purpose of today's video, the grading on severity is based on the narrowing of the joint space, osteophyte formation, and other bony abnormalities or degeneration. Since you may be wondering after that middle point, osteophytes are small bony growths or spurs that happen around an affected joint. They can affect the way the joint moves, and they're actually normally a result of friction that was happening within the joint from before. All of this to say, osteoarthritis is diagnosed based on clinical symptoms, objective findings, as well as radiology like x-ray. But what does all of this mean for you if you have osteoarthritis? Let's clear this up right away. If the degeneration in a joint like the hip or the knee is bad enough, joint replacement surgery may be indicated. But for the purpose of this next section, let's assume that the current arthritis is not warranting a joint replacement surgery. What do we do? Well, I mean, I am a physio named Jonah, so say it with me. Exercise! Nobody said it, did they? Manual therapy and acupuncture are two other treatments that I'll often use for osteoarthritis patients depending on the location and severity, and I do find them to be quite helpful. But it's really hard to overstate the importance of active therapy and exercise in the management of osteoarthritis. Exercise should not be something you fear with a diagnosis of osteoarthritis. In fact, quite the opposite. Exercise and being able to move is one of the key components of day-to-day management of osteoarthritis. This is for two main reasons, the first of which is motion is lotion. Moving your joints helps to keep them well lubricated and moving over time. Remember back to that symptoms list from earlier? One of those things was that it was stiff in the morning or after an extended period of not moving. A lot of times with arthritis, getting moving actually helps things become less painful and feel less stiff. The second, more active movements means more muscular strength around the joints in question. For example, with knee osteoarthritis, the stronger that your muscles that surround the knee can be, the less strain that will be placed through that knee when you go throughout your day-to-day activities, which then allows you to do more of those activities, which then contributes to more strength. Do you see how important exercise is here? In terms of what exercises to focus on, low-impact aerobic exercises, whether they are land or aquatic-based, is usually one of the go-tos when we manage osteoarthritis. Quick note on the aquatic therapy though, doing your exercises in the water can be helpful for some components of therapy. However, there is obviously a lot of value to doing your exercises on dry land and getting that more natural joint loading. If you made it to this point in the video, thank you guys so much for watching. It's really cool to me that there are viewers like you out there who are interested in these same things that I love talking about, so I look forward to continuing to make more videos like this in the future. If you enjoyed the video, hit that thumbs up button or leave me a comment in the comments section below. Either one lets that infamous YouTube algorithm know that you enjoyed the video, which then helps it to reach even more people. Consider subscribing if you haven't already so you don't miss any of the upcoming videos, but most importantly guys, as always, move your body, have a laugh today, and I will see you at the next video. The OG arthritis, the original arthritis, none of this barbecue arthritis.